to explain the key principles of change management, explain how changes in health and social care are planned, and then lastly, to be able to assess how to monitor recent changes in health and social care services. All right. Okay. So let's look at learning outcome 3. What does it entail? As usual, Danny on lectures today. So we have to look into the key principles of change. For metaphors, will be the organizations as machines, organizations as political systems, organizations as organisms, and then organizations as flux and transformation. Those are the key metaphors when it comes to organization, how people see them, the changes in the organization. Where organization change could be that one to define the future state or outcomes and results. 2, to look at how to assess current states, the readiness or preparedness to learn or adapt to those changes. 3, to look into a bit more, redesign a change management plan to seek to put in place against the change that you have identified. And then 4, to implement and mentor the plan. The change that you have identified and designed, you have to then put it into practice to implement it. And then 5, you have to look at how we can stabilize. Having implemented, how then do you put in quality measures and quality control measures to stabilize or monitor those changes? And then lastly, to be able to evaluate mid or long-term results along the line when those change has been enacted. Would have to look into evaluations quarterly or yearly, right? Now we have to look into the key principle of change. Where a one-line manager per employee, we can look into the division of labor into specific roles. Each individual should have key objectives, very key. Team, simply the sum of the individual's efforts. Managers should monitor, control, and report and maintain discipline within their people. Those with running organization should have a senior management, very key, can change it all at will. We should have a change that can be designed, planned, and will work if we execute and control. And then lastly, there will be resistance and needs to be managed. Changes that need to be driven through the organization. So these are some of the things that that is changes, seeing that as a metaphor in terms of a change, an organizational change from the perspective of a machine. That's the first metaphor, seeing that as a machine. Then we have to look at organization change from the perspective of political system metaphor. That you have to look at everyone is part of the organization politics, very key. But people have different levels of power. True. Okay. You need to build support for your approach if you want anything to happen. 3, it's useful to know where the power lies and where the coalitions and alliances are, and i.e. the political map. 4, allocation of scarce resources is achieved through negotiation and influences. It's politics, so it's always about influence. 5, sponsorship by a powerful person is vital for successful change. Very key. 6, the wider the appeal of the change, the better. Powerful overture will help. 7, important to understand the stakeholder map, real winners and losers and their power bases. And then lastly, positive strategies include building alliances and negotiating terms. So this is seeing organization change in the metaphor of political perspective. All right, we've done machine and we've done political. Then we have to look at seeing that as an organism metaphor. One is that there's no one best way to design or manage an organization. That is key. The healthy functioning of different parts of the system is important to whole system and success. The flow of information between subsystems is key to success. It is important to maximize the fit between individual, team, and organizational needs. 5. Changes are only made in response to changes in the external environment. Personal, very key. The response to a change in the environment can be designed and worked towards. Lastly, participation and psychological support are necessary strategies for success. And then lastly, organizations have the propensity to prefer steady states and contain balancing forces to maintain this. So they prefer to keep it on a steady state, on a stabilized state, and then continue to balance it forces to maintain those propensity. So this is very key. Seeing that as an organization metaphor or organism metaphor. And then lastly, the flux and transformation metaphor. That in itself is an order naturally emerges out of chaos. Organizations have natural capacity to self-organize and self-renew. Natural capacity to self-organize and self-renew. 3, organization's life is not governed by the laws of cause and effect. Very key. The word is chaos. Change cannot be wholly managed. It emerges. 6, managers do not act upon a system. They are within it, affecting change daily. 7, tensions and conflicts are important source of healthy change. 8, managers help to contain change and create the right conditions for change. Managers help to contain change and create the right conditions for change. So these are the 4 metaphors when it comes to organizational change. From the perspective of organism, from the perspective of political, from the perspective of transformation, and from the perspective of machines. All right. Now let's look at the organizational change models. What then would them? We have the 11 3-step model that we need to read about. We have the Bullock and Patterns plan change. We have the Kotos 8-step model. We have the Beckhard and Harris change formula. We have the William Bridges managing the transition of your organization, the Pearson system model, and the Stacy and Shaw complex change leadership. These are things we have to read about. So let's look at the Lewin's change management model. If you have a large cube of ice, but realize that you want is a cone of ice, what do? First, you must melt the ice to make it amenable to change or freeze. Then you must mold the ice water into the shape you want to change. Finally, you must solidify the new shape in freeze. So it's about refreeze, change, and refreeze. Unfreeze, change, and refreeze. So you unfreeze the ice to get a liquid state. Then you can re-put them into something or a container to get a shape that you want, and you refreeze that solidify. So these are the Lewin's model. And then we have to look at the Bullock and pattern plan change. You can read about those things and move fast track. Cortex 8-step model is established sense of urgency, forming powerful guiding coalition, creating a vision, communicating the vision, empowering others to act on those vision, planning for creating short-term, consolidating improvements, and producing still more change. And then you have to institutionalize those approaches. You have to put it into practice in the organizations. The Beckhard and Harris change formula, it comes with change level of satisfaction, CABTX, what we call it, and desirability of proposed change or end date, practicality of the change, and then cost of changing. So this is what we call CABTX. And then we have the William Bridges, which seeks to introduce the Bridges change model in 1991 called Managing Transition. The Bridges transition model that did something that you didn't find in another change model. It was to draw a distinction between change and transition. So you have a change, but then During those change, you definitely have a transition from the old way of doing things to the new way of doing things. And those is what we call transition. It needs to be managed properly. It needs to be managed properly. Okay, that's what it means. And then we have the Peter Senior system model. The key thing is that you start small, you grow steadily, you don't plan the whole thing, and then you expect challenges. It will not go smoothly. Key things: start small, grow steadily, or stay focused. Don't plan the whole thing. Do it in gradual process, and then expect challenges. There will definitely be challenges. Okay, and there are guidelines. You can start with pilot groups, stick to the basic rules, and expect your challenges. Very key. For every change, there will be challenge. Okay. And then the lastly is the Stacy and Shaw complex change. This underpins that one, you decide that what business organization is in and stretch people's thinking on how to get there to ensure that there's a high level of connectivity between the different parts of the organization. And lastly, to stay focused, to focus people's attention on important differences between current and desired performance, between style of working, and between past and present. I've always said it's always about the past and the present when it comes to change. But then we have to look at the basic key principle. Change is process that any organization would have to go at some point of time. Very key. Whether it is to make changes for the sake of change, to keep up to date with it, a new technological advancement, to adapt and reflect to service users' needs, or even emerging and restructuring management structures. The word is restructuring management structures. So this is why we may have change. But there are key principles of change management. One is to keeping people supportive and engaged in the change process, ensuring that staff and clients are all on board, but explaining what the change is and why it is taking place. Very key. There should be transparency. There should be the reasons why the change is being brought about, so that the staffs can run with you in your change or your transition. Okay. Then you have to look into using appropriate and timely communication throughout the whole process, communicating the process of change clearly by keeping every stakeholder in the loop in a timely manner, communicating at appropriate steps, giving right information at the right time, and not overloading and confusing stakeholders. Very key. Communication, effective communication becomes a key determining factor. And we have to look at the implementation of the plan. This is when the proposed changes will actually take place. One, this period of time can be chaotic if not manageable. True. There may be a period of settling for staff and service users. And three, hand-holding and training may also be required to process the change. Even the hand-holding is what we call shadowing. Okay. You do it and then observe somebody doing it whilst you're observing what you have taught. So you call shadowing, very key. And then regular monitoring and review of the process. At this stage, you need to monitor your changes consistently and review them. What effect these changes are having? Are the changes effective? Are the changes making a day more efficient? Or are they having adverse effects on the service users? So you have to ask yourself these questions in your reviews so you can have a better answer to your change. And then lastly, taking appropriate steps in the light of review issues. After you have monitored and reviewed, you now know what appropriate steps you will be taking. Of course, such as staff training, amending, adapting to things that are not working, keeping the process that are implementing them other areas as well. Those are things. So reviews will always give you informed, practical way to go about as to decrease costs, increase staff, areas of improvement and all that. So these are things that you can look into once you have done your review. And the changes in health and social care settling are planned through a consultation with staffs and care users. Care users are consulted in order to understand their health needs and evaluate how those needs have been addressed in a specific institute. Very important. Then we have clarity about present position and a desired future position, the Beckham and Harris. Having a much broader view of the organization, managers must often notice the need for change for earlier than do employees. Therefore, they may often find themselves faced with general resistance to any change initiatives as individuals generally favor the status quo. It's very key. So we need to sort of identify the change a bit earlier rather than later, because employees are used to old ways of doing things, and therefore, if you are trying to shift them from their old way to a change or a new way of doing things, you're going to have opposition and resistance. Then also the Beckhardt change equation aims to serve as a simplified way of analyzing the potential success or failure of a change initiative within the workforce. It effectively describes the situation which is required for the desired change initiative to be successful. Very, very, very key. A simplified way of analyzing a potential success or failure of change initiative within the workplace. It effectively describes which is required and the desired change initiative successful. Okay, right. The original formula for change was this we can read about. It was derived in the 1960s, but it was modern change equation by 1980 by organizing theorists by the organizational theorists Richard Beckhardt and Robert T. Harris, from whom this particular model arrives in its name. It was then further simplified and published in 1980 in the early 90s by experienced mentor Kelly Damela. This we can read about. Then we have to look into how our plan. D refers to dissatisfaction with the current situation. Responsibility, therefore, over the future vision generally lies with higher management. F refers to the practicality of the initial tasks required to work towards the goal. And the R, people dislike change even after all the necessary arguments have been put forward. There is generally at least some natural position which remains. Okay? Which remains naturally, which remains. So our people dislike change, and even after all the necessary arguments have been put forward, there's generally at least some natural position. It is very key when it comes to change management. What then will be the characteristics of good planning? Good planning would have to have a good oriented strategy. You need to have a preservative ideas. You need to have continuous activity, intellectual process, futuristic ideas and plans, decision making, and then managing the function as well. Why? Now, the 5 YEF set out why the NHS needs to change. The 5 YEF next step sets out what will change in the next 2 years and how goals of the FYF will be achieved. STP now stands for Sustainability and Transformational Partnership. Okay, change role for the NHSE focus shift decisively to supporting delivery and implementation of key priorities. Public view, top 5 issues citizens want to see improved are addressed in the next step: mental health services, GPs, hospital charge, and better social care and reduce cancer rates. So those are the 5 YEFs that we need to know about. The next step based on the 5 paradoxes facing the NHS is that we're getting healthier, but we are using the NHS more. We're performing better, but we're more transparent about more gaps, mistakes, so perception is skewed. We are more stable, but they are under greater pressure. Public are satisfied with the NHS, but concerned with its future. There is consensus on how to future-proof the NHS, but the ability to do so is overtaken by firefighting. So these are changes or what has been identified that needs to be worked on. So how do you work on what then will be the priorities? Urgent emergency care, primary care, cancer, mental health, integrated care, funding and efficiency, workforce, patient safety, and technology and innovation. Where urgent emergency care would be different by September 2017, all trusts will be achieving. Okay, 90% of the 4-hour target, front door clinical screening, 85% of CH assessment in the community, implementing the high impact change. So these are all things that should be put in place to help to achieve those changes. You know, how will it happen? 100 million capital funding, modified A&E to enable streaming, clearer local performance initiative, drop contract fines from April, and focus on SVTB, single national leave. So these are all things that you can read about. That helps to understand what some of the changes that the NHS put in place. And then what will be different? Increase convenient access to GPs, streaming emergency appointment to alternative professionals, pharmacists, therapists, 100% access to the OH booking appointment by 2019, extra 5,000 GPs, expansion of the multidisciplinary primary care, 1,300 extra clinical pharmacists, 1,003 physician assistant, 1,003 MA practitioners. So you're just trying to put in different measures so that you could be able to meet up the changes or the problem that you have identified. And we have to look into increased investment in GP services, encourage practices to work in hubs and networks for population size 30 to 50,000 from virtuation, sharing community nursing, MH clinical pharmacy teams, expanded diagnostic facilities, poor responsibility for urgent care and extended access, contract reform, transition from QOF to revised to framework. So these are things that you have to look into. And we have to look at cancer. What will be different? Better surviving rates, expanded screening for preventive and early diagnosis for bowel and cervical cancer, faster test results, new standard of definitive diagnosis within 28 weeks from 2020, and radiotherapy agreed. These are all things that we can read about. Then we have to look into mental health. What will be different when it comes to mental health? 6,000 extra places for taking therapies, better care for expectant and new mothers, improve the camps, care closer to increase inpatient invest for camps, especially MH care in increase physical health checks for people who have MH process, specialized transition services for veterans, and new specification for inpatients. Very, very key. You can talk about the national and local investment standards, support from local authority to reduce detox, MH patients, greater transparency through the MH mental health dashboard, the Council Green Paper 2017, name them. All these are things that we have to look into. Then we can talk about integrated care. All the different. A new partnership, the ACs can agree on accountable performance contract with the NCS and NHS, manage funding for the defined population, interrogate horizontally and interrogate vertically. Okay, having one hospital on different sites or GPs and individual hubs, where the ACs could have designated commission rights, develop promotional funding package, a one-stop shop regulatory management arrangement, and replace staff and attributes. Okay. We also have to have the new STB boards in corporation, which I've spoken about that. You know, the NHSE will also deploy its own staff locally where appropriate. NHSE will allow CG to realign the government. NHSE will provide a policy framework under the STB will operate. STBs will be judged by a success rather than assured by perception. Funding and efficiency. Free up to 3,000 hospital beds. Further clamp down on temporary staffing costs. Use NHS procurement clause. Get best value for medicines and pharmacy. Reduce affordable demand and meet demand for appropriately. Okay. We have to then look at reducing unwarranted variations, estate infrastructure. These are all things cut costs, basically in appropriate administration and all that. Workforce, how would you handle that? How would it happen? New fast track program next first, new advanced clinical practice, new EU rostering and job planning, 25% more medical group places, leading STPs and ACAs to be to offer staff flexibility. Patient safety. What would change? Preventive healthcare, acquired infections, increased maternity safety, learning from deaths, improved inspections, improved investigation, reducing medical errors, a new patient safety incident management system, PSIMS. What about technology? What would change? One-on-one online, one-on-one telephony, online appointment bookings, availability operation records, electronically, increase apps to enable people to manage their own health. Okay. We have to look, how do we assess or monitor recent changes in health and social care? Effective monitoring is key, okay, in health and social care. And the monitoring process comprises of internal and external analysis to measure change. Can you hear me? Hello? 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 Can you hear me? Hello? Can you hear me?
Yes, I can. I can hear you.
I couldn't hear you.
Oh, sorry. I was hearing you. I've been hearing you.
That's what I don't know. I couldn't hear. Then we have to look at the monetary changes as well, where we do carry out regular reviews. That's on it. Regular reviews ensure to have feedbacks, so we could implement them to the various areas that needs improvement. Then we have to look into using those information generated reviews to make adaptations, and then assess against your KPIs, okay, your key performance indicators, and all that data analysis. Then we can also talk about the achievements. Achievements against stated aims. What have you been able to achieve as a person or as an organization against your objectives, your visions, and your missions? Okay. So, what achievement, progress is being made? Are the aims being met? Continue monitoring over time to assess those further impacts. So, you should be able to see that your visions that you have you been able to achieve your quarterly visions, your mid-year visions, or your yearly visions? Those are key things that you have to do in your monitoring processes, monitoring your recent changes in health and social care. There should be your achievements against your aims and objectives. What have you been able to achieve? Is the achievement going well? Are you getting the right achievement, or is it a negative achievement? So those are the things that when you monitor, you can come out and say, listen, I think we are doing well. I think we are hitting our target. I think the changes are going well, or the changes are not going well. Then it therefore needs another review to see what is going wrong and what needs to be put in place. Okay. So today we've covered the key principles of change management, explaining how changes help in health and social care as planned, assessing how to monitor recent changes in health and social care, and the references you can get them from your student model. Let's say that you have anything to say, any question?
No, I understand. I understand the procedure that change is needed. It's constant, and you have to be open about it. You have to carry your colleagues along. You have to get their views. You can't be an authoritarian. You have to monitor the change in order to get effective results. You understand? So I'm going to read about it more in order to do my learning outcome.
That's fine. That's fine. So you have any questions, do you?
No, maybe when I read about it, I'll be able to get more details.
That's fine. Do that and let me know, okay?
All right. Thank you, sir.
You're welcome. You're welcome. Bye-bye.
Bye.
Now. and therefore we have to ensure that we have to teach it. So therefore, once you have to, then one of the things you have to do is to ensure that most documents will need to be emailed, and therefore, as lectures, one of the things you have to understand that you need to implement those documents and ensure that you have done. And changes in healthcare is very key. You need to look into your KPIs, the key performance indicators, and ensure that data analysis to ensure what has been achieved. Hello. Hello. Yeah. No, I don't need share code on your British. I don't need share code. Okay. Let them know that's what I sent to you. Don't need share code. You're British. Okay. Tell them so, eh? Hello, Otto. Uh, my sister. Yeah, me, I don't like plenty talk. Oh. Eh? I told you. Mhm. No, my it doesn't work that way in the UK. Oh. We don't do that. Oh. Okay, this is not Nigeria or Africa. You know, you didn't tell me this as well. You're asking for pictures. I knew. My sister, please, oh, when dealing with me, I like transparency. I don't like this kind of attitude. Understand? Mm. You're asking for pictures, they want you to see pictures and they will pay. Just like that. Oh, 1 minute, 1 minute. Hello? Yeah, so, oh, buy it. Oh, very good. Very good. More breaker now. Okay. Of course, you love it. Good. And then learn how to write. So you can also be a skilled person. Like I said. Step back. No, I should step back. The child.
Especially Nigerians, if we are from the same tribe or we are able to speak the same language, we easily cross ourselves. And no, so I don't know you that much, but I think that some kind of trust and confidence in you. With the little time I know you are a truthful person. So there's a way I will talk to somebody from my own tribe that will understand and have confidence in me. And moreover, their account, their parents is not my account, it's business account. So and they have the assurance that okay, their money is not going to be embezzled by anyone. So you understand? There's no any problem. Thank you. They have really checked they have asked me series of questions. Are you sure the place is this that? Even me, I've not been there. But I just believe that well, you have something good and something that worth the value of what they are paying for. They understand. So that's why I'm requesting for this picture. It's only that person that was not in Nigeria that was requesting for picture. It's not as a coming for viewing this afternoon. As I said, they should be there before 3. So I'm even expecting their call. They are on their